Did you know that nearly 30% of individuals with diabetes and 40% of those living with diabetic retinopathy or diabetic macular edema are not receiving routine exams? Hello, I am Dr. Regina Benjamin, former United States Surgeon General. I am a longtime champion of the power of prevention. While I have left the position, I have not left the mission.
Diabetes affects 1 out of every 10 adults in America. And regarding its impact on vision, there are over 8 million Americans living with diabetic retinopathy and diabetic macular edema. Diabetic retinopathy is the leading cause of new cases of blindness in adults.
Well, there are so many memories, quite honestly, and I never get, the right word is not tired, but I never become accustomed to the changes the diabetic retinopathy can cause in the eye.
It's the negative ones that stick with me. It's the young people. It's the 35, the 37, the 33-year-old with a young family who goes blind from diabetic retinopathy that should have been treated years before.
Well, the call to action is really to everybody in the healthcare system who takes care of people with diabetes to understand how complex it is. And because it's so complex for the patient, how we all must work together and communicate with each other.
There's nothing worse for any eye care provider when we see patients walking in the door that have vision-threatening diabetic retinopathy that could have been prevented simply because of awareness.
Vision loss caused by diabetic retinopathy can have a significant impact on a patient's quality of life. The acronym ASSERT-D was created as a reminder to be more proactive in the screening, referral, and treatment of diabetic retinopathy in patients with diabetes.
Diabetic retinopathy is a when problem, not an if problem.
It's not simply, what your hemoglobin A1C is today, but what it was 20 years ago.
I want to be sure that patients are empowered to go see their eye care specialist.
So patients with non-proliferative diabetic retinopathy are at an increased risk of developing proliferative disease.
In the past, we haven't had much treatment for non-proliferative diabetic retinopathy. There was a tendency to defer treatment until patients exhibited signs of proliferative disease. But now, through the RISE and RIDE and the Panorama studies, we've learned that we can actually create a regression in the severity of retinopathy, which is really turning our profession into being more proactive against vision loss as opposed to being reactive, where we waited for clinical findings to worsen before intervening with treatment.
This blindness prevention initiative is called Saving Sight, Preventing Vision Loss. The critical role of early diagnosis, referral, and treatment in diabetic retinopathy and diabetic macular edema. It's a mouthful, but it sums it up. I invite you to join us in a comprehensive continuing medical education curriculum sponsored by the National Eye Institute.